Gummy smile talks gone wrong. This is a perfect example of when the LLSAN muscle or levator labii superioris alaeque nasi muscle doesn't fully respond or is missed altogether. Let me walk you through what happened here. This particular patient came into me for full face talks, and specifically, she wanted to target her gummy smile. These are examples of gummy smiles. You can see when each of these patients express or smile, their upper lip pulls up dramatically, exposing a good amount of gums. A great and effective treatment to reduce the amount of gum exposure is injecting neurotoxin or Botox, Dysport, Jeuveau, Xeomin, Daxxify, Latibo, any of your neurotoxins in the LLSAN muscle or LSAN muscle to effectively treat this gummy smile. This muscle is a strap-like muscle that originates at the frontal process of the maxilla and runs on the lateral part of the nose and inserts into the upper lip. Its normal function is to help elevate that upper lip during expression, and it's also involved in nasal flaring during expression as well. When we inject the LSAN muscle, we sit about 1 centimeter lateral to the nasal ala. This precise location is documented as the most safe and effective way to treat the gummy smile muscle or LSAN without impacting nearby muscles such as the levator labii superioris muscle or the nasalis. So about 1 centimeter lateral to the nasal ala is typically that safe spot where you can only impact the LSAN muscle and not necessarily worry about other ones. I typically dose it about 5 units per side per LSAN muscle. So you want to hit both muscles symmetrically. But we can see that something went wrong with this particular patient of mine. When she expresses on her right side, when she puckers in particular, you could see that left upper lip still is able to elevate and pucker, whereas the right upper lip is relaxed and almost paralyzed. And that's exactly what our intended result was. The left side looks like it didn't take or it needs more units. You can also see when she smiles how that left upper lip still elevates. So how did this happen? Likely what happened is either A, I missed the LSAN muscle altogether, or B, she has a more dominant LSAN on the left side versus the right and requires more units on the left side. For this particular patient, either she's an anomaly, an anatomical anomaly, or an outlier patient that her LSAN sits a little more lateral or a little more medial, whatever the case may be, her result is completely asymmetrical. And as an injector, it's my job to fix that for her, right? So what I did was I brought her back and I injected an additional 5 units in her left LSAN muscle, and within a few days it relaxed and did the job. Now going forward, we know that either A, I need to treat her maybe with 10 units on one side and 5 units on the right, or I need to change my injection pattern altogether for where I precisely dose her in that left LSAN muscle. Either way, it's a quick and easy fix, but these are things that happen. As injectors, we do our absolute best to try to target the patient's specific anatomy. We sit there, we watch them express. Our goal is for them to have beautiful results, right? But sometimes things go a little left, right? And we have these little aesthetic complications. I wouldn't say this was a massive complication. It's an easy fix, but it is something that I'm going to be mindful of with her going forward. Again, as injectors, we do our absolute best to treat our patients and give them the best results possible, but sometimes there's variations in anatomy, and this particular patient is a great example of that. Either A, I missed it altogether, or B, she has a dominant left LSAN and I need to dose it a little higher. But really looking at your patient's unique anatomy and not just doing these blanket injections for every single patient is so crucial and really is what's going to help you stand out amongst other injectors when you're really targeting their particular anatomy. So if you love these videos, please hit the subscribe button. Help me get to 1,000 subscribers by the end of the year. I'm getting closer and closer, and it makes me so happy that you guys are interested in watching these videos. And if you have any requests on any videos, please comment below. I would love to take requests and record some videos that is tailored to what you're looking to watch. So thanks, guys.